Good afternoon, everybody. It's Lillian here from the Health Center. Today, I just wanted to introduce you to our new nurse practitioner that we've brought on board with the Cold Lake First Nations Health Services. Mary Obstfeld joined our health services at the end of August. And so she joined us as a nurse practitioner for our community. So Mary, maybe just explain what a nurse practitioner is and how you're there to help the community.
Sure. Yeah, so for those of you who don't know, a nurse practitioner is actually an advanced trained nurse. So basically, most of us start out as RNs. We work for a few years, or in my case, a few more than a few. And then we go back to school and we do some more training. And the training, we learn a lot of the things that you typically think about as a family doctor doing. So basically, coming into the community, I can help people who are struggling to find the healthcare services that they're looking for in seeing a family care practitioner.
Absolutely, and definitely a need here within the community. I know a lot of people struggle at trying to find a doctor or even keeping a doctor because doctors seem to come and go quite quickly around here. So I guess, what is your background and experience in nurse practitioning?
Yeah, so in my case, I started out with my RN training. So I did a 4-year program for my Bachelor of Science in Nursing. And after I did that program, I worked primarily in emergency setting, but I also did some work in the ICU as well. And I knew that I wanted to be a nurse practitioner, so I wanted to get a really good background in knowing how how to care for people and see how sick is sick, those kinds of things, to be able to work in a rural or remote setting. So I ended up doing some work as a travel nurse and worked in some rural and remote communities. And then my final job as a RN was working in a clinic, so then I could understand what being in a clinic was like. So I worked in a gastroenterology specialist clinic and worked with people with inflammatory bowel disease, so Crohn's and colitis, and also worked with hepatitis patients, so primarily hepatitis C and some hep B patients. So then after that, I figured I had some pretty good knowledge under my belt and went back to school. And so that's when I did 2 more years of schooling. Got my master's in nursing, and then that also gave me my nurse practitioner designation. And I chose the family all ages route, so that allows me to see everyone from babies
That was
to
kind of my
older
next
people.
question is do you have an age group in which you see? So you can see right from babies to old age.
Yeah, I see everybody.
Very good. So what are you hoping to offer Cold Lake First Nations community members here on the nation?
Yes, so as we discussed earlier, I'm hoping to provide some consistent medical care to people. So I know that there's a lot of people who have struggled either to keep a family doctor or family care provider, as well as to find one initially. And that's been pretty difficult for a lot of people on the First Nation and outside of it. So basically, what I can do to help people out is be that primary care provider.
Right here on the nation,
Yeah,
which is
at
wonderful.
the clinic.
Yeah.
And also we're partnering with Glacier Gate
Yes.
with Dr. Gari and Dr. Aboud. So I also work out of their clinic a couple days a week. So that gives people options on where they see me.
And I think it's been working. We've had a really good flow thus far. So if for some reason you're calling and you're booking with our clinic to see Mary, if I can't get you in to see her while she's at our clinic, then I also have the ability to book you to see her at the Glacier Gate Medical Clinic, or Dr. Gari or Dr. Aboud. So we've actually really expanded that arm of our health services to ensure that we're making that primary care a real focus for people who've had difficulty.
Yeah.
So I know that we have talked a lot about, looking at preventative medicine here on the nation, and that being, something that I really want to get behind. So what type of preventative activities can you provide for the nation, or can people access through you?
I think one of the biggest things is screening. So a lot of people have not been coming in for their routine screenings, and those can include pap tests, that can include lab work, like looking for diabetes, for example, blood pressure issues, FIT tests for colorectal cancer, all of those types of things. We do have regular screening guidelines, so there's a certain timeline that people should be having those tests performed. But if you don't have a regular care provider or have difficulty getting in, you may not be getting those follow-ups. So that's something that I certainly could help people with. And having said that, even if you do have a primary care provider, but you're having difficulty getting in with them, I can also help with that too. So people could come and see me, say you have a medication you need to have renewed, or you have some concern that you're struggling with and you can't get in right away. You most certainly could come and see me, and I would work collaboratively then with your care provider. So I'm not taking over, I'm just there as part of your team.
You're there as part of the team. And like, and that's a good addition for our services, because I do know that sometimes, even with my own family practitioner, I may have to wait, 5 or 6 weeks in order to see my primary physician. And sometimes if it's just for a medication renewal, or let's say I end up with a sinus infection, the last place I want to be sitting right now is in an emergency room waiting for service. And so I encourage all of you out there to utilize our services here at the Nation. Come in and book with Mary. Come and see Mary. It helps to alleviate that pressure that's on our healthcare system, especially right now. But it also gives you kind of a medical home, so that you always have somebody that you can access for even just the simplest of things to even more complex, because I do know that you work with Dr. Gari and Dr. Aboud in the more complex clients, and that is very helpful as well. What if somebody has a family doctor, but they have something they need before they can get that appointment? So those types of people generally would be like prescription refills. And how does that work collaboratively with their own primary physician?
Yeah, so for the patients who see Dr. Guri and Dr. Aboud or anyone else through Glacier Gate Medical, the nice thing is we are connected with them, so we have the same EMR, so that's the electronic medical record, so we can speak to each other through that EMR. When it comes to patients who are outside of that and they see other clinicians, I can still see them. The communication may have to be by phone call or something like that with the care provider, but often we would just treat it just like you would if you went to a walk-in clinic, where you could see another care provider. But like Lillian said, we want to try to keep people from having to go to emergency services, and a lot of people these days don't want to sit around in a walk-in clinic either. So we're not doing walk-in, but we are doing booked appointments, and we seem to have pretty good availability at this point in time.
Yeah, so our availability right now is very good. It's usually within 1 to 2 days of getting people booked in to see you, whether it be here or at Glacier Gate. I do see that uptake of services is starting to increase, which is amazing, because realistically, you've been here a month and a little bit. So that's amazing to see that people are utilizing your service, and I guess really finding that value in service that I was hoping. So again, thank you very much for coming over to Cold Lake First Nations and championing primary care right here on the Nation. And we are really honored to have you and to be able to make this step in that direction to fulfill those needs for people in the community who have been lacking that primary care. Basically, I think is that pretty much it? Oh, I wanted to talk about some of the other services that you provide. So I do know that you can do some minor procedures here on the Nation that we've never been able to offer before. Suturing. If somebody gets a minor cut, you're able to offer suturing, correct?
Yes, I am.
Okay, and I know that you're right into the skin.
Yeah, so any
dermatological
people who have some lumps and bumps, concerning moles, warts, those types of things. Yeah, we're going to try to get some of that treatment going on as well. I think that'll grow over time as people come into the services. Then we'll know what kinds of equipment we'll need to bring in to take care of that. But if the want and the need is there, I think we're willing to move forward and make that happen.
Absolutely. Yeah. And again, just to that preventative screening again, we've been really good here on the Nation over the past few years with Alberta Screen Test and getting women's mammographies done. We've had a very high uptake of that. We have been doing pap smears for many years on the Nation in conjunction with the doctors that were coming in, as opposed to waiting until something happens. So just that whole preventative maintenance goes a long way, and I think being able to add that to our service delivery model here on the nation is so important.
And circling back to the women's health as well, I am a big proponent for women's health and birth control options. So also to know that we do have some additional options that are available for women. One being birth control implant, which a lot of people don't realize is available, and I also do that. And we'll be working on doing IUD insertions as well. So any of those options that women want to come in for, we'll hopefully be offering all of those right out of clinic, so you don't have to go in town for that either.
Beautiful. What about prenatal and OB/GYN services?
Yeah, I'm glad you mentioned that too. Typically, I follow the early stages of prenatal and can then refer over to your OB. So typically, I'll follow women up to about 16 to 20 weeks, unless it's a more complicated pregnancy like twins, or there's been something that's come up in the pregnancy and you need to see OB sooner. But there's no reason why you can't follow me for the early stages. And then we do refer to your OB in Cold Lake.
Awesome.
Yeah.
So for all of you pregnant ladies out there, please come in and access services early. Again, we still have the CPNP program that you can access as well. You sign up with Christina, qualifies you for a coupon every week to help maintain that maternal nourishment during pregnancy that you need. So please come in and see us, and we'll get you booked in to see Mary at the same time if you don't already have a primary care physician. I think that's about all for today. I do want to mention to all of you out there on the nation that we have started flu vaccination clinics as well. So anybody who is over the age of 6 months can get a flu vaccine, and I highly encourage you again this year to do that. We are, still in a pandemic. It's still really important to try to suppress all of the respiratory illnesses out there. And one of the best ways to do that is through vaccination. I would like to say that we're starting to see a light in COVID. Our vaccination rates actually on the nation are just below 70%. And I'm so happy because the response from all of you in the last month and a half has been phenomenal. Great job. And I would love to see you come in and get your flu shots done as well, because that's also very important to do and help preventing influenza during this season.
And if anyone has any concerns about vaccination and have
Mary.
any more questions, I would really, really enjoy having conversations with people. It's not to push the vaccines, but it's to gain more understanding about them. And I think once people have a chance to talk to somebody they trust and understand a bit more, then it helps usually with some of the fears that people have with vaccination.
Absolutely, and thank you very much for your help in having those conversations, because they really have gone a long way, I think, in dispelling people's fears and anxiety and some of the myths that are out there for sure. All right, so to all of you in the nation, have a great day, and we hope to see you at Cold Lake First Nations Health Services very soon. Thank you.
Thank you.